How and why should public health be involved with mental health issues? Stick around and find out. Firstly, I just want to quickly talk about what it is that we mean by mental health. And we all know about depression, anxiety, bipolar mood disorder, schizophrenia, etc. But there's also a side of mental health, the positive attributes of keeping well, of keeping a positive attitude, of good, strong relationships, of an ability to work, etc., etc. And a big part of mental health is nurturing that side of ourselves. So even well people have an interest in mental health because each of us should be trying to foster a good mental health within ourselves. A little bit of context. My name is Greg Martin. I am a medical doctor and I have worked in psychiatry both in South Africa and in Ireland. I work now in public health. And so I'm very interested in how we can use the tools, the public health tools, to address mental health issues. All right, so let's get stuck in. So in the next few minutes, I want to talk about how we can use public health tools to address mental health. So here's the bag of tricks. These are the public health tools I want to apply in the mental health space. Firstly, prevention. Next, screening and early detection. Next, surveillance, in other words, quantifying and tracking the problem. And then, of course, improving access to services, advocacy and policy change, research, collaboration and integration, so an all-of-society approach, crisis intervention and support, cultural sensitivity and inclusiveness, and helping vulnerable and hard-to-reach populations get access to the care and treatment they need. Now, a lot of what we talk about falls under the heading of health promotion or health improvement, and we're going to start off with prevention, right? So our first category is prevention. And in terms of prevention of mental health disorders, I think there's three opportunities to think about. First of all, early detection. And we're going to talk a little bit more about early detection in just a minute when we talk about screening. But early detection, so this often involves training educators, parents, and health professionals to recognize early signs of mental illness. Next is reducing risk factors, and this can be through providing safe spaces and support groups for people that have experienced trauma or abuse, or addressing things like alcohol abuse. Okay, and that brings us to the third one, which is policies. And this can include legislation aimed at controlling the sale and distribution of alcohol and other substances. Now let's talk about screening. And of course, this relates to the first point because it's about early detection, but we could instill routine screening. So for example, integrate mental health assessments into regular medical checkups. And part of this is really also identifying at-risk individuals. So not just people that are unwell, but people that might be at risk of becoming unwell. That could be about their family history, it could be their own history, it could be about environmental factors. Another public health tool that's important in the mental health space